we are seeing a patient here from Oregon here, and I wanted you guys to see her underwear. So this is our patient with her back. So tell me what happened, because this is really interesting, guys.
Yeah, so I just wanted to lose around 10 pounds, and I know a lot of people and friends who've tried that Ozempic or Mounjaro, and I thought, oh, this would be easy, I'll just lose 10 pounds. I started using Mounjaro once a week injection, and it just, not hungry. I lost 10 to 12 pounds in 7 weeks. I quit taking the Mounjaro then, but still my bottom kept changing and going flatter, and it's eating the muscle away basically.
Yeah.
And so the Mounjaro cannibalizes muscle. And so I lost my butt, and that's why I'm here to see Dr. Agha, and now I have these padded underwear until he can put some implants in there.
Yeah, so this is one of the problems of using these wonderful weight loss medications. It actually causes loss of muscle at the same time, and we are seeing more and more of patients who've lost weight and muscle as a result. And now you know what happens.
Muscle in the arm as well.
Yeah, I'm sorry.
Triceps.
Well, thank you for sharing your story. You're educating all of us.
You're welcome. Thank you.
Thank you. So today we are doing a lower body lift without a tummy tuck. Our patient has previously had a tummy tuck, and her tummy looks really, really good. She's lost about 10 pounds of weight on Mounjaro, and more than that, she's lost a good amount of her buttock muscle. She works out vigorously, but despite that, she has had muscle wasting that can actually occur as a result of using weight loss medications such as Ozempic or Mounjaro. So today we'll be going in, tightening the front of her thighs. You can appreciate the skin wrinkling that has developed as a result of weight loss. We're going to be doing a thigh lift in the front, continuing that on the outer aspect of the patient's thigh, and then finishing that with the on the back. I'll show you the back. We're also going to be doing an inner thigh lift. This is one of the hardest plastic surgery procedures that I do, because they tend to want to migrate, meaning that the scar that you place at the junction between the labia and the upper inner thigh, essentially your groin crease can migrate over time. So when I do it, I do a lot of anchoring sutures. I try to not only lift it up, but also make sure it stays there, and I do an overcorrection of that area. And every year I end up doing 5 or 6 of these revisions when patients have had the surgery elsewhere. They're very, very hard to correct, by the way. And then on the back, as I said, she's lost a lot of volume from her buttocks. So we're going to be using all this excess fat that we have and actually rotate it and put it into the buttock over the muscle, so that we can create the fullness that she used to have. She's thin. I'm not going to get a lot of augmentation, but anything at this stage is better than nothing, and she's going to end up with a much smoother and tighter and fuller buttocks at the end of this surgery. So you're looking at the back part of our surgery. This includes a buttock lift, buttock augmentation with lower back fat flaps, some liposuction, additional fat transfer into her lower buttock. And as you can appreciate, we have made a nice change and made her buttocks perkier and fuller and rounder in the process of lifting them and utilizing every ounce of or every gram of excess fat to augment her buttocks with. So on the front, I continued with the outer thigh lift and completed the thigh lift in the front. Our patient had previously had a beautiful tummy tuck and therefore did not require a revision, but what I did is to utilize her previous tummy tuck incisions and essentially cutting most of it out to perform the rest of the surgery, coming to the inner thighs. As you know, this is one of the hardest plastic surgery procedures. And what we did is an inner thigh lift, whereby we removed about 1.5 to 2 inches of excess skin and then lifted the upper inner thighs and reconstructed the groin crease. And this is the invagination of the groin crease that has been reconstructed meticulously. It goes from here all the way to down there and ends up just underneath the buttocks. And I do an element of over correction of the lift so that if we get scar settling or migration, we still end up with incisions that are hidden in a bikini.
Okay, we are 4 weeks out, and our beautiful patient who's here from out of town, she wants to go home. She's healed beautifully. You cannot even see her scars from her surgery. We did a anterior thigh lift, so front of thigh lift, outer thigh lift, inner thigh lift, and a butt lift with buttock augmentation using her own lower back fat pad. So, let me see your butt.
Dr.
The front looks great.
Dr. Agha did an amazing job. I'm so happy.
The scars are beautifully hidden by this little thong. So
Yeah.
you can't even tell in a bikini what you had done.
Can't wait to shop for one again.
She was saying she used to wear needed underwear.
Yeah, I mean it. Dr. Agha had videoed. I'd taken Mounjaro only for 10 pounds, but you know, I probably shouldn't have, because then it really kind of ate away at the muscle tissue, the glutes, and so then it all fell. So he pulled it all back up and
Yep.
did the
It's
reshaping.
beautiful.
Yeah.
Did a little fat transfer.
Yes.
And then turn to the side. So we also lifted the side of her thigh. So a nice smooth outer thigh in the face of front. So a nice smooth front of thigh. And the inner thigh was lifted.
Yeah, this is quite
All of the
good.
incisions are either in her groin or underneath the thong, so you can't even tell.
Yeah, it's awesome. He did a great job. I recommend anyone who's thinking about it. No regrets.
Beautiful. Thank you for coming. I'll see you soon. She's still healing, but she healed very well. No issues.
Yes. Awesome.
So we are looking at one of our beautiful patients from Oregon. She's back for a follow-up 5 months out from a lower body lift, and you can see how beautiful she looks, and you can see how much of the weight and the correction of the butt she's retained. We've lost some of it, but she's retained most of it. What she has retained is going to be permanent. The upper butt is filled up with her own lower back flap, and the lower butt has transferred fat. So this is now permanent. These are her incisions. I'm going to rotate you again. The incisions are placed in such a way that she can wear a thong and hide them, and you can see how beautiful these incisions look and how beautiful her contour has come to heal. Okay. You like it?
Yeah, I do. I'm really happy. Thank you.
You're welcome.